We're going to see cor pulmonale. Cor pulmonale is heart failure due to a lung disease. So we have the heart, this is the right atrium, right ventricle, left ventricle, and left atrium. Here are the valves. Here we have the aorta, and here the pulmonary artery. Here are the lungs. When there is a problem in the lung, the pressure of the pulmonary veins, pulmonary capillaries, and pulmonary artery would be increased, and so the backward pressure would be increased. So backward for the pulmonary artery is the right ventricle. So increase in hydrostatic pressure of the ventricle that can cause dilation, a ventricular hypertrophy, etc., and backward to the right atrium if it is very severe, the lung disease that is now causing the heart disease. So this is the pathophysiology. This will present, the clinical presentation will be exertional syncope or exertional dyspnea and fatigue. This is due to decreased cardiac demand, and the syncope is due to decreased cardiac output, because the failure of the right ventricle promotes that we cannot expel more blood, and so if there is no blood that is expelled to the lung, then the blood cannot return to the left atrium through the pulmonary veins, and so there is left volume in the left ventricle, and so the volume cannot expel through the aorta, and so the patient has decreased stroke volume, and so less cardiac output, and so the patient can present with exertional syncope. The diagnosis could be with ECG findings, or echocardiography, or with catheterization, that is the gold standard. In catheterization, we will see pulmonary hypertension, pulmonary artery hypertension, that is greater than 25 millimeters of mercury. We will see increase in the filling pressure of the ventricle, and in echocardiography we will see the consequences of increased the hydrostatic pressure in the right ventricle. That would be in hypertrophy, right ventricle hypertrophy, or dysfunction. We will see hypertrophy of the cavity, so increased cavity size. Sometimes, if the dilation of the ventricle is severe, the tricuspid valve could get enlarged, and so there is regurgitation or insufficiency of the tricuspid valve. And in the ECG, we will see the signs of right ventricle hypertrophy, that is, the R in lead V1 is greater than 0.7 millivolts. If it is severe, that also there is enlargement of the right atrium, we will see greater than 0.25 millivolts in the amplitude of the P wave in leads D2, D3, and AVF. And sometimes we can see complete or incomplete right bundle branch block, and because there is increase in the myocytes of the right ventricle, we will see right axis deviation. So cor pulmonale is the heart failure caused by a lung disease, most common obstructive pulmonary disease, and will present with exertional symptoms, could be dyspnea or syncope, and the gold standard for the diagnosis is the catheterization.